Now, let me turn to this question about health system. There are a lot of people who were saying, well, what do we learn about our healthcare system? And from this COVID outbreak, what is the reflection or what is the reform of healthcare system that we should be thinking about? And one of the question is, shall we build more hospitals? Because I think this is very much driven by this conversation that we have had many weeks on that how do we flatten the curve and flattening the curve so that we are beneath that capacity. But very often when we are talking about capacity of healthcare system, we're talking about the number of beds and number of ICU beds. And that is the acute care section part of it. So I saw this just 2 days ago from a WeChat from China. Wuhan in one day launched building 6 major hospitals, medical centers. Each one of them is over 1,000 beds. If we think about the resource allocation in China, already 57% of the resources are concentrated in tertiary hospitals. I think it is an important question for us to think about. What should we do for the future? Shall we be doing more hospital building? This is a very enlightening table from Italy, and I'm sure most of you have heard that. The experience from Lombardy versus another province, Veneto. And the major difference is, of course, 1, the infection rate, 2 is also the case fertility rate. The major comparison that scholars have been doing is Lombardy uses a hospital-based management approach, whereas Veneto uses an out-of-hospital approach, primarily relying on community, trying to keep people out of the hospital, give them tests, quarantine them, tracing them. And again, also, China actually has a very effective strategy, which Chinese is called 网格管理, which translated to, again, managing through organizing community. I think COVID-19 bring out a very interesting comparison between a more hospital-based approach versus a more community-based approach. And I do think it is ripe to try to model the relative strategies of a country can use that actually might impact the effect of it. And also modeling what if country actually were able to build up its primary health care to be stronger, to be able to take some of the function that in the early phases are actually done by the hospital, to have people's trust in it. And I think it is very important at this point to begin to think about the relative trade-off between hospital versus primary care, hospital versus communities. Community is definitely broader than even primary care, because it is going to be very important in helping government to think about resource allocation for the healthcare sector before it goes down the wrong way.